Hello, I'm Jane Lane from the University of Alabama at Birmingham. I'm the Clinical Coordinator and Research Nurse Manager at the Rett Syndrome Clinic and Project Manager for the NIH-funded Natural History Study of Rett Syndrome and Rett-related disorders. I'm very happy to have the chance to talk with you by audio recording and slide presentation about puberty and beyond in those with Rett syndrome, discussing normative data, menstrual management, health maintenance, and safety. The onset of puberty in all parents is cause for concern, and particularly so in parents of girls with Rett syndrome. To consider why this transition causes such concern may help to alleviate the fears that parents often express. While this slide lists just some of the reasons for worry, I will focus on these during my short time with you today. I will begin by sharing information on puberty and sexual maturation from the largely North American study of the natural history of Rett syndrome. Rett syndrome parents observe what they perceive to be premature development of their daughters' bodies and equate those observations with early menstruation. This slide summarizes almost 9 years of longitudinal data of breast and pubic hair development and the onset of menstrual cycles, and compares these data with typical U.S. female development. Breaking this down by specific development, pubic hair occurred in Rett syndrome at an average age of 9 years and occurs about a year earlier than typical U.S. norms. About a fourth developed pubic hair at what would be considered to be premature, and a small percentage were delayed. The time frame between pubic hair development to menstruation is about 4.5 years. Breast development occurred at almost the same age as typical U.S. Females, and with essentially the same patterns of premature or delayed development as shown in pubic hair. The time frame from the onset of breast development to menstruation is slightly shorter at 3.9 years. In this study, menstruation occurred at essentially the same time as typical U.S. females. Among those with Rett syndrome, there were other predictors for the age of onset of puberty. Those who were overweight or obese by BMI, or body mass index, experienced earlier pubic hair and breast development, but did not experience a change in the onset of menstruation. Those with a milder presentation of clinical symptoms or clinical severity had earlier breast development and onset of menstruation, but no change in pubic hair development. And those with milder MECP2 mutations began menstruation earlier, but did not show any change in pubic hair or breast development. These data were published in 2014 and were summary data from the natural history study. Next, I would like to share some information about menstrual management. You might wonder why this would be of interest to you as a parent, but I would say that comfort, convenience, protections from pregnancy, and the management of seizures that might occur around menstruation each month might be reasons to consider menstrual management. Hormonal or surgical methods are methods often used, but many families decide not to intervene with their daughter's menstrual cycles. Hormonal or surgical management or methods, common hormonal methods may be delivered by various mechanisms, and the specific hormones are either estrogen, progestin, or a combination of these chemicals. The methods may be delivered by pills, injections, intrauterine devices, or skin patches. Common surgical methods are endometrial ablation or hysterectomy. This slide summarizes the methods, delivery, benefits, and risks of hormonal medications. Please notice the items in the risk column, as these may pose particular risks in Rett syndrome. Specifically, the risk for blood clot formation is increased in those who are not able to walk and sit most of the time. We've also found that Rett syndrome appears to increase the chance of gallbladder disease, and this may be compounded if on an estrogen-based contraceptive. Likewise, progestin-based hormones have a negative effect on bone density, and as this is already a concern in Rett syndrome, we recommend not using these. They may also cause significant weight gain and aggressive behaviors. This slide summarizes the method, delivery, benefits, and risk for surgical options such as endometrial ablation and hysterectomy. Ablation is the destruction of the uterine lining using either heat or laser, and hysterectomy is the removal of the uterus and or ovaries. And the risks that are the most common or the most concerning are listed to the right under the risk column. I would like to talk just a minute on the implications for seizures with the onset of puberty. This slide shows the changes that occur during a menstrual cycle. Estrogen and progesterone, indicated here by the blue and the black lines respectively, are produced by the body and fluctuate, as you can see, throughout the month. We know that seizures are more likely to occur when estrogen is at the highest and progesterone at the lowest. In a 28-day regular cycle, this would occur approximately day 11 or 12, and therefore it may be that at this time that you notice an increase in seizures, well before menstruation would occur at the end of the month. For the sake of time, I'm not going to discuss in detail the next two slides, which first discusses the effects that anti-epileptic drugs have on hormone contraceptives and the effects that hormone contraceptives have on anti-epileptics. But I want to provide this information for you that you can read on your own. Next, I would like to talk about health promotion and maintenance in the adult. The next two slides list health screening tests with ages and frequency recommendations for typical adults and illustrates the need for basic health care. While these recommendations are for the general population, there are risks specific to Rett syndrome, such as poor bone density, that suggest an earlier or more often screening would be beneficial. The risk for poor bone density is greater in those who are non-ambulatory or who are taking seizure medications, and we watch this very closely in our patients in our clinic. Obtaining mammograms and pap smears pose particular problems in a woman with Rett, and while important, may not be essential in everyone, as is shown on this schedule. Parents often ask me if gynecological evaluations and examinations are necessary for their daughters who are not sexually active. While it is true that most cervical cancers are caused by viruses that are introduced through sexual intercourse, we must also consider the right to equal access to health care while weighing the practical aspects of the exams. And therefore, I advise parents usually of women with Rett syndrome to decide about gynecological and breast health examinations based on their current conditions and family health history. Any discussion about gynecological health promotion should include vaccinations against HPV or human papillomavirus. This virus is the most common cause of cervical cancer and is transmitted during sexual intercourse, including non-consensual sexual intercourse. I know in Europe and Eurasia, the vaccine is available and might be considered in even Rett syndrome preteen girls who might come in contact with the virus, even if that contact is a result of sexual abuse. As parents and advocates for your children, we must be aware of the risks of abuse. Yes, these can happen at any time, and not just at puberty, but it is foremost in our minds at that time. The facts on abuse are startling and upsetting. particularly as we consider children with disabilities who are twice as likely to be sexually abused, or that adults with developmental disabilities, among those, as many as 83% of the females are victims of sexual assault. And regardless of age, race, ethnicity, sexual orientation, or class, women with disabilities are assaulted, raped, and abused at more than twice the rate of non-disabled women. And unfortunately, the abusers are varied. They may be natural family members, neighbors and family friends, or service providers, including direct care staff, personal care attendants, and even physicians. However, I would like to leave you on this positive note. The future is bright for those with Rett syndrome. We have made important strides in care and have positively impacted health for all ages, but particularly for the adult with Rett syndrome. I send you warm wishes for a successful meeting, and please feel free to email me with questions. I'll do my best to answer you at any time. And thank you so much.